Hello, my name is Beth, and I am an infectious disease pharmacist, and I'm on faculty at the ULM School of Pharmacy. I want to spend a few minutes speaking with you about the role of a pharmacist, especially in a clinical setting, and how that relates to you in the audience. You may be thinking, don't you just work at Walgreens and count pills all day? What else is there to do? Well, surprise, that's not necessarily true, and there's a lot more to do. In the next few minutes, I plan to give you a rundown of these objectives, each of which target a broad array of what pharmacists do, are capable of doing, and may be doing in the future. I'll even relate our job to the specific case that was presented to you at the beginning of this event, hopefully, if my timing is right, to give you a more hands-on example of why pharmacists are such an awesome part of your team. I think I could spend at least 30 minutes talking about each of these objectives, but for the sake of time and your sanity, I'll try to keep it brief. Our role in healthcare is so broad. There are pharmacists out there practicing in areas that even I don't know what they do. But to boil it down for the types of pharmacists you'll be working with, let me tell you that pharmacists' roles are to first and foremost provide patient care, but also our goal is to be a part of the team that provides that kind of care. For example, let me show you a picture of mine or of some friends of mine from Kentucky, where I moved here from. This is a picture of the hematology oncology team that sees patients admitted to the hospital. I promise you, they do work with patients and don't just pose for pictures. Most teams are composed of an attending physician, or the boss man of the team, some medical residents, which are shown by red arrows, some medical students, shown in the yellow arrows, and in this case, the green arrows are the inpatient clinical pharmacists, and this is one who happens to specialize in oncology, believe it or not, and this is a pharmacy student. So they round on patients, they take an in-depth look at their medications to make sure the doses are right, the indications are correct, and they even speak directly with patients in the hospital regarding those medications. More often than not, these pharmacists, believe it or not, don't even touch medications or count pills. It's shocking, I know. In the picture on the right, you see an outpatient pharmacist. This is probably the pharmacist that you're used to seeing, the one who works at your corner drugstore and helps to provide patients with medications and education about those medications. This is barely touching the surface of patient care that these superheroes provide on a daily basis. You've probably heard it before, but we're essentially the legal drug dealers. We just make sure the medications are appropriate and safe. Not only do we deal drugs legally, but we get to educate those who take those drugs on a one-on-one basis. You'll often find a pharmacist in the patient's hospital room providing important pieces of information on new medications that patient may be going home on. This happens at your local corner pharmacy, of course, as you've probably witnessed being counseled by a pharmacist, but pharmacists can spend time and educate patients in a variety of settings, including places like long-term healthcare centers too. I'll tell you that pharmacists don't get to where they are overnight. There's a long drawn-out process, and some of us are a glutton for punishment to get where we are. So our schooling is a 4-year process, complete with 3 years in the classroom and 1 year of clinical rotations out in the real world. Once those 4 years are done, all you have to do is pass a couple of board exams and you're ready to practice pharmacy. However, some of us, remember I said that some of us just want to torture ourselves, go on and continue our education at about half the salary and twice as many hours a week as our other friends in the form of doing a residency. So residency isn't required, and you can choose to do up to 2 years of residency. So I happened to do my residency both years at the University of Kentucky, as pictured here. And this is a picture of me in my second year with my co-residents. And the second year is where you can specialize in different areas. For example, I specialized in infectious diseases, but other specialties like cardiology, oncology, critical care, pediatrics, emergency medicine, and ambulatory care also exist, among other opportunities as well. Trying to predict the future of any profession is kind of like, well, predicting the future of anything, really. But in my opinion, and take this with a grain of salt, because let's face it, I've been a pharmacist for a whopping 3 years now, but I think the practice of pharmacy is about to hit a huge growth spurt. It's already growing in a sense that not long ago, my kind of position and training didn't exist as robustly as it does today. With the expanded growth of pharmacists practicing in specialty areas, we're showing more of our worth as an integral part of the healthcare team. There are major pushes across the country to give pharmacists this so-called provider status so that we can make autonomous decisions regarding patient care. So stay tuned on that front. One fun part of being a pharmacist is that we get to play with a lot of cool stuff. Now, of course, we have the cool pills that often look like candy that we get to play with, but let me give you a disclaimer. Don't ever let patients, especially children, think pills are candy. But there are also other cool gadgets like inhalers that we can play with in order to educate patients on the correct usage of these devices. We also get our hands in the mix when dealing with different types of IV medications, like antibiotics shown here, that are used in the hospital. In fact, some pharmacists, myself included, have been known to take those medications, hook them up to IV lines, and start running the pumps and everything in patients. I want to send a thank you to my nursing friends who have shown me how to do things like this. So we also help patients who may need to check their blood sugars using things like glucometers. Pharmacists are lucky in that we're never at a lack of gadgets and gizmos to play with. In this slide, you can read the case that was, again, hopefully presented to you earlier today. I want to take the last final minutes to let you know the areas in which pharmacists can play a pivotal role from start to finish in this patient's care. First, we could technically address the past medical history and discuss the counseling points that pharmacists would make when the patient picks up prescriptions for her hypertension and diabetes. There may even be a pharmacist who sees the patient in the ambulatory care clinic and helps manage these medications at regular checkups with the physician. Now, regarding the stroke, many clinical pharmacists, myself included, sometimes in the middle of the night, believe it or not, are part of active stroke alert protocols and respond to the bedside for stroke alerts. In my experience, I would rush to the CT scanner and help evaluate the pertinent information regarding the onset of the stroke, the lab values, maybe the past history of strokes or bleeds. There are certain medications that have a narrow therapeutic index and are only recommended for use in certain patient populations. Pharmacists work with neurologists to decide when and if those medications are deemed necessary or if they're contraindicated. I even got to experience not only ordering the drug on the electronic chart, but also mixing up the medication at the bedside and injecting that medication and working with nurses to evaluate the follow-up and watch for side effects after administering the drug. After surgery, which let's assume a pharmacist has approved and verified the correct dose and duration of the medications that are used before and after surgery, when the pneumonia develops, someone like me, an ID pharmacist, is there to ensure that the correct antibiotic is used at the right dose, for the right duration, and with minimal side effects. And then, upon going home, there may be a pharmacist in the hospital to counsel the patient on any new medication the patient may go home on. Then the cycle repeats, but hopefully with no repeat stroke. So hopefully you've come away from this short presentation with a little bit better of an understanding of how pharmacists can impact patient care. Thank you for your time and attention, and we look forward to working with the rest of the awesome healthcare teams.